of 2019, coronavirus were found in the live animals that been sold at the Hunan seafood market. On 12 January 2020, the coronavirus have been spread from human to human in more than 100 countries in the world. Coronavirus is a large family viruses which may infect the respiratory system in animal and human. The most recently discovered coronavirus disease was COVID-19, which have been found in Wuhan, China. In terms of COVID-19, research suggests that on average the virus incubation period is about 5 days. Nearly 98% of patients develop symptoms within 11.5 days.
Coronavirus is come from family Coronavidae and can be divided into 4 genera. Incubation period for coronavirus is about 14 days. Coronavirus contains single-stranded RNA and functional spike protein and enveloped glycoprotein. This is structure of coronavirus. This is flow of entry mechanism of coronavirus into the host cell. This is figure of life cycle of coronavirus in host cell.
Effect of coronavirus, lung and respiratory tract. When the virus gets in our body, it comes into contact with the mucous membrane that line our nose, mouth and eyes. This virus will enter a healthy cell and use the cell to make a new virus part. Acute respiratory distress syndrome is the condition that causes the fluid to build up in the lungs so no oxygen cannot get to the organ. Is respiratory syndrome is the viral respiratory illness including fever and shortness of breath. Respiratory tract. The corona will affect the upper and lower part of our respiratory tract. It will travel down the airway. Effect in different cases. The mild and moderate cases. It can cause dry throat. Pneumonia is an infection in which the alveoli are inflamed and the sign on the chest of X-ray or CT scan. The second one is the severe cases. It will affect the both lungs. As the swelling gets worse, our lung fill with fluid and debris. The last one is the critical cases. The infection can damage the walls of the lining of the air sac in our lungs. Effect to other organs. The first one is brain. It can cause encephalitis. Encephalitis is inflammation of the brain due to the viral infection. The next one is the heart. This virus can lead to the inflammation to the heart and damage to the muscle. The next one is the stomach and intestine problem. The virus can cause loss of appetite, nausea, diarrhea, and indigestion. The last one is pink eyes or conjunctivitis, and inflammation of the conjunctiva.
There are many ways to prevent yourself or others from spread the COVID-19. Clean your hand frequently and truly with alcohol-based hand or wash them with soap and water, because washing your hand with soap and water or using alcohol-based can kill the virus that may be on your hands. Avoid going to crowded place because you are more likely to come into close contact with someone that have COVID-19. You also need to maintain at least 1 meter distance between yourself and others, because if anyone coughs, sneezes or talks, they release a tiny liquid droplet to their nose or mouth that may contain a virus. So when you go near to them, you will also breathe in the droplet that contain a COVID-19 virus. If you have a fever, cough and difficulty breathing, seek medical care early and share previous travel history to their healthcare provider. You also need to avoid contact with others, stay at home and self-isolate, even with the minor symptoms such as a cough, headache, a mild fever until you recover. Have someone bring you supplies. If you need to leave your house, wear a mask to avoid infecting others. To avoid touching your eyes, nose and mouth, because hand contact a number of objects that can pick up the virus. When infected, your hand will pass the virus to your eyes, nose or mouth. The virus will enter the body from there and infect you.
Treatment for patients. There is no specific treatment were found for coronavirus, but there are some treatment give beneficial result for patients that suffered from coronavirus. Chloroquine and hydroxychloroquine are medicines used in the treatment of malaria. These medicines have shown some effectiveness toward coronavirus, which include the acute syndrome and COVID-19 virus. Chloroquine and hydroxychloroquine have been shown to kill the COVID-19 virus in the laboratory dish. When the virus managed to get inside cell, the drug killed it before it can be multiplied. They also use HIV drug. Combination of lopinavir and ritonavir give beneficial to patients who suffer coronavirus. In the city of Wuhan, they have been using HIV drug Kaletra and the changes of lung experience were really great. Kaletra associated with positive therapeutic outcome in treatment acute respiratory syndrome. Convalescent plasma is a plasma from recovered patients. When people recovered from COVID-19, their blood contained antibodies that their body introduced to fight the coronavirus. The antibody helped the patient fight the illness or reducing the disease. This treatment is still considered experimental.